When performing abdominal ultrasound exams in dogs and cats, choosing the right probe is key. It's important to understand the characteristics of each type and use them appropriately. There are three main types of probes commonly used for abdominal scans: microconvex, linear, and convex. Let's go through each of them one by one. First, let's talk about the microconvex probe. This is generally the first choice probe for abdominal ultrasound in dogs and cats. TS main features include a small footprint that contacts the patient's body, a tight curve at the tip for better maneuverability, and a frequency range that typically covers both low and high frequencies. T's small and easy to handle, easy to rotate, and easy to press gently into the body. In short, it's very user-friendly. That's why it can be used to cover most of the abdominal scanning. Next, let's go over the linear probe. The image quality is excellent with this type. Because it can operate at high frequencies, it gives you very detailed views of small structures. However, the large footprint can make it more sensitive to hair artifacts, and the size of the probe itself can make handling a bit more difficult. In practice, we usually start with the microconvex probe for a general survey of the whole abdomen, and then switch to the linear probe to take a closer look at parenchymal organs and fine structures. Finally, let's talk about the convex probe. This is the standard probe used in human abdominal ultrasound. It typically works at lower frequencies, has a broader curve at the tip, and provides a stable grip. In veterinary medicine, it's mainly used for large breed dogs. Because of its low frequency, it's good for scanning deeper structures. But due to its wide footprint and large size, it's not very easy to maneuver. That's why it's not ideal for cats or small dogs. Still, it can be handy in situations where fat or other factors make it hard to see structures clearly. It's worth having one available just in case. To summarize, start with the microconvex probe to get an overall picture of the abdomen in dogs and cats. Then switch to the linear probe to evaluate organ parenchyma and margins, like in the liver, or the wall structure in hollow organs like the GI tract, bladder, or gallbladder. In large dogs, the convex probe is also quite useful. That wraps up our overview of ultrasound probes used for abdominal exams in dogs and cats. Thanks for watching. And as a final tip, if you're having trouble visualizing deeper areas with the microconvex probe, switching to a convex probe can really help.